These lectures are not designed for use as medical references to diagnose, treat, or prevent medical or mental health illnesses or trauma. If you have questions about the diagnosis, treatment, or prevention of a medical condition or mental illness, you should consult your personal physician or other mental health professional.
When I was 5 years old, I came down with a nasty case of tonsillitis. Back then, it meant a trip to the hospital to have a tonsillectomy. Hospital? Surgery? Both me and my mom were terrified. Fortunately, my pediatrician gave me a little comic book called Tommy's Tonsillectomy. The picture book walked me through the process step by step so I would know exactly what to expect. Tommy was brave, and I would be too. Even better was the field trip we took to the hospital. I got to see what a room looked like, what the nurses might do, and best of all, I learned that I could eat as many popsicles as I wanted after the surgery. I went from scared to excited. I didn't know it at the time, but what we were doing was rehearsal, mostly cognitive rehearsal, but there were some behavioral rehearsal strategies too. It was cheap and effective in helping a little boy suffer a little less. We now know that pre-surgery videos, books, and stories not only reduce anxiety, they improve outcomes. Patients literally do better when they go in prepared. It's most likely lowered stress, which means better healing and improved adherence to any post-surgery protocols or medications. Sometimes simple things can make a big difference. And in case you're wondering, I still have my copy of Tommy's Tonsillectomy. Welcome to our lecture on blended cognitive techniques. We'll be reviewing the contents of our toolbox and adding in a few new tools that tap both behavioral and cognitive skills. Rehearsal, microaffirmations, savoring, stress management, and assertiveness. At this point, we've covered quite a bit of foundational knowledge, described essential attitudes, and demonstrated several basic and a few advanced behavioral and cognitive skills. Let's just take a moment to review what we have and then add in a few more tools. Now, for foundational knowledge, we know all about the CBT triangle. We're able to identify cognitions, behaviors, and emotions. We have an idea of the differences between cognitive content and cognitive processes, and we're able to classify subtypes of each. We understand some of the different types or categories of behaviors, and we understand how both cognitions and behaviors can be summed over the course of a day to help us to understand our overall mood rating for that day. We've heard about the primacy of behavior, particularly from the perspective of behavioral activation. We've learned about the cognitive model, that it's not a situation that makes us feel a certain way, it's the situation plus the way we think about that situation. We've learned some essential attitudes about change. It happens. Always. We've learned the necessity of problem solving, of rolling up our sleeves and seeing what we can do and testing things out. We've learned to take ownership and responsibility, but not to blame ourselves. And we've developed a deeper appreciation for context. Some of our basic skills have included self-assessments, goal setting, these were our SMART goals, self-monitoring of all sorts of varieties, and we've been able to identify and to sort cognitions from behaviors from emotions. On the behavioral side, we've used activity records, we've used activity scheduling, with a variant of pleasure predicting where we rate how much pleasure we think we'll have, then go do the experiment and re-rate the level of pleasure experienced. We've also learned about behavioral experiments. We've learned graded task assignment, things like breathing, meditation, progressive muscle relaxation, which all fell into the category of somatic quieting. We've learned about exposures and their special relationship to anxiety and reducing anxiety, and we learned about rewards and punishments as part of contingency management. Now, cognitively, we've learned how to capture the content and the process. We've learned about habits of mind, our biases, and we've learned how we go about making decisions using this information. We spent some time learning about thought records. We used the 7-column variety, where we have the trigger, the emotion, along with its intensity rating, automatic thoughts, evidence for and against, eventually coming up with the balanced thought, and then the new intensity rating for the emotion. Again, you can find this on Google by Googling CBT 7-column thought record. Cognitively, we've also learned how to manipulate our attention through selective attention exercises. And today, we're going to add in 3 more cognitive exercises or skills: cognitive rehearsal, micro-affirmations, and savoring. For stress management and assertiveness, you'll see that we already have those tools in place, but they'll be packaged and applied in a slightly different way. We're also building some meta skills of how to know when to use a tool and how to select a tool, and then how to troubleshoot if things don't quite go the way that we want it to. Just remember, we all need regular practice to build up those muscles. Let's now see the toolbox in action. Amanda has mastered several tools, but she's not yet taking the initiative to use them. Let's hear about a situation that calls for some of those tools. So Amanda, why don't we roll up our sleeves and do a little bit of work of tackling some complex problems that might have emerged in the past week or two. We have our CBT skills toolkit, so it's a great chance if things have happened, we can pull it out and figure out which tools you might want to apply. So can you think of an example of maybe when some negative emotions got stirred up, or you felt stressed, or things weren't going the way you wanted them to go?
Yeah.
Okay. Tell me about it.
So my brother stops by for dinner.
Yeah.
And, you know, I love him, you know, and I'm proud of him. But, you know, there's always that whole thing with him being my parents' favorite, and they just kind of ooh and ah over everything he does, everything he says. And, you know, we're sitting at the dinner table and he's talking about, you know, a patient that he was treating, and, you know, how, you know, this patient had been misdiagnosed with other doctors, and that he was able to figure out exactly what was going on with them and treat them, and, you know, how much better they're doing now under his care and all of that. And I'm sitting there like, hi, I'm still here.
Yeah.
Does anybody care? I mean, I'm here.
Yeah.
I mean, I just felt like nobody saw me in that moment, that it was just all about him and how great he was and how smart he was. And I just felt invisible.
Yeah. And I hear you here sort of laughing about it, but I'm guessing in the moment that it didn't seem so funny.
No, I was really angry about it, actually.
Yeah.
I mean, it's like, you know, yeah, he's a good guy. He's a smart guy. He's an accomplished guy. That's all great. That's all wonderful. But, you know, doesn't anybody care that I'm still here, you know? I mean, it doesn't have to be all about me all of the time, but it could be about me some of the time, right?
Yeah. And you've mentioned this dynamic before in your family, and oftentimes when things recur, it's easy to sort of quickly feel your heat rising, right?
Mm-hmm.
And because it's, you know, here we go again, you know, and all those cognitions and all those thoughts that come up. So in the moment, what was the experience? You said you're angry, but was it sort of a rising anger and you felt the heat coming up, or what?
Yeah, because it was kind of like, you know, you go sit down for the dinner and your hope is that, you know, well, maybe this time it'll be different. You know what I mean? That maybe this time I might feel like I'm a part of the conversation, or I'm a part of, you know, whatever's happening. And, you know, little by little, it just got to the point where, you know, mom and dad are just, you know, fawning over everything that he's saying, and, you know, telling him how, you know, smart he was, and how, you know, how great of a doctor he was. And, you know, and I'm just sitting there like, really? I mean, it just, you know, it just makes you feel worse about you, because at least for me, I felt like I can't get to where he is. I will never be who he is to them. And it was really just really frustrating and really angry, made me really angry, because I'm like, no one sees me, you know, it's all about him all of the time, and I don't matter.
Yeah. So what'd you do?
So, I mean, I just kind of, I did what I always do, where I just kind of just sit and I'm really quiet. I don't really say much, because I'm afraid if I say something, that I'm just going to explode with all of the anger and all of the resentment that I feel towards him. And it's not even really about him. It's more about how my parents see him and how they interact with him. And I just kind of backed away from the whole situation. I mean, I was sitting at the table, but I wasn't really saying anything because I was really afraid that if I said something that it wasn't going to be good.
So here she's basically just reporting an incident that carried a lot of charge for her. You can hear her frustration and how this really pushes a lot of complicated buttons. Is she loved? Is she valued? Do her parents care about her as much as they care about her brother? The end result of this spiral is she shuts down and she's afraid of exploding. Let's see if she can now apply the CBT toolbox to find a way out.
So that's a great example and maybe a good opportunity for us to pull out the CBT toolkit, and we can look at it together, look at the tools that you've learned and that you've practiced, and see which ones, and I say ones because I think it's going to take a couple, right, to help you through this situation. So here we have your checklist, and we have the general skills, we have cognitive skills, and behavioral skills. So if you look over this list, which of those do you think you would want to use first? And imagine yourself in the moment, and we can talk about skills to use afterwards too, but if you're there at the dining room table or wherever, you see this dynamic, you start having those emotions that are pretty strong. What do you do first? What tool do you use?
I would probably use the somatic quieting, the breathing.
Yep.
Because, I was really, really heated in that moment. And I think that maybe if I just kind of took a moment to just kind of breathe and just kind of exhale it out, maybe I would have felt a little more calm about it. And less rage.
Okay, right. And that's sort of a good rule of thumb is if the emotions run too high, it's harder to think clearly, it's harder to respond in a way that will be constructive. So trying to turn down the heat with some somatic quieting, you use example of breathing, there's a couple other things that you can use. Situational modification is one of them. So it's possible, if you know that he's coming over for dinner, to invite another person. That might diffuse things a little bit. It's possible to leave the room. Sometimes people leave the room and go wash their face or talk to themselves in the mirror, or whatever it is that helps to, again, sort of bring them back down, keep things in perspective, and help them to bring their wise mind back to the table and not just the sort of emotional mind. So you'll do some somatic quieting. You're feeling a little less enraged at that point. Then what else do you do? Like what other tools? And I'll let you.
Probably the coping statements.
Okay.
It's funny because it's not like this is a situation that has never happened before. This happens pretty much every time my brother comes over. And I think that maybe if, once I'm calmer, that if I just remind myself that, that they don't mean, that it's not a bad thing, that they don't mean to hurt me or to harm me by, exalting him, but at the same time, I'm still okay. I'm still worthy of their love. I'm pretty sure that they still love me. Yeah. They're happy for him in this moment, but I'm not totally forgotten about that. I'm still a good person. I'm still worthy of their love, and I just need to remind myself of that.
Yeah, and I see you using two really key CBT skills there, and one is, and you can't really do this in the moment, but doing a thought record where you write out the automatic thoughts you have about your parents, about their love for you versus the love for your brother. You wrestle with those thoughts, you rewrite those thoughts into a more helpful format so that it affects your feelings in a more positive and constructive way. That's kind of a longer, slower exercise that takes usually a lot of iterations before you feel that it's effective enough. But once you've done it, once you believe it, once you've got it to where it is, you can shrink it down to a shorthand. And those are the cognitive coping statements, where instead of going through this long thought record, you can say, I got this. I know that they don't mean it. I know my parents love me, but they express it in a different way. Or thinking about constructive next steps. You know what? I've never sat them down and talked to them about this and let them know how I feel. Picking the right time, the right place, making sure the temperature is right to have the conversation. But sometimes we do need a little bit of constructive, but maybe conflicted conversation with someone to let them know that what they're doing affects you in a way they may not intend.
She first uses somatic quieting to cool down so that she can think more clearly and carefully. Note that she planned to use some cognitive rehearsal. She wanted to use self-talk as part of her tool set. She might do a thought record afterwards. She might also talk with her parents afterwards. So how did this work out? Well, she was able to decrease her level of emotional arousal, but she's not yet talked to her parents. That's sort of a big step. So what happens next? What would she do in round 2? How would you troubleshoot? What advice would you give to Amanda? When selecting a tool, there's a few important steps to consider. First, of course, you need to know when to select the tool. Second, you need to think about your goal. Do you need to regulate an emotion? Now, she chose somatic quieting as a place to start. Are you trying to address an interpersonal issue? Trying to address a deficit in functioning of some sort? 3, what are your current parameters? Like, how much time do you have? What resources will this require? Do you have the energy? With that said, I do want to take a moment and address an issue that often comes up. With all of this roll your sleeves up approach, it's easy to fall into the trap of self-blame. I have to do all this work because I'm a mess. I'm undeveloped. I'm flawed. All those core beliefs can come bubbling up. If that happens, it's a good time to break out the skill of non-judgmental acceptance and kindness, or self-compassion, and to remember those cognitive skills regarding balance and selective attention. But let's take a moment to unpack the idea of self-compassion. I found some excellent books on the topic, like The Gifts of Imperfection by Brené Brown, The Rough Patch by Daphne D. Marneff, The Art of Gathering by Priya Parker, or a couple of books by Pema Chodron, an American nun, The Places That Scare You, or When Things Fall Apart. What is self-kindness or self-compassion? According to Kristen Neff, self-compassion entails being warm and understanding towards ourselves when we suffer, fail, or feel inadequate, rather than ignoring our pain or flagellating ourselves with self-criticism. And sometimes you even have to be a little bit meta about it. You need to be self-compassionate about not being self-compassionate just yet. But how do we get there? In Kristen Neff's work, mindfulness meditation is the primary tool. And remember, we've talked about sort of 3 things that meditation can give us: an increased focus or awareness, the ability to concentrate. Secondly, it helps with that somatic quieting that we've talked about. And third, and probably most related to self-compassion, is developing that sense of self-acceptance. Let's move now to add in those new tools, and let's start with cognitive and behavioral rehearsal. Now, we've all done this somewhat, especially the behavioral part. We do disaster preparedness drills, or we rehearse a piece of music on the piano. But the cognitive rehearsals are a bit different and are probably underutilized. With cognitive rehearsal, the goal is still to reduce anxiety and help you tap the skill set that you already have. But here you use your mind's eye to begin imaginally exposing yourself to the feared object or situation. Since it only exists in our mind, we're then free to embellish it however we want, and that usually means envisioning the desired outcome, our dazzling success. I recently used this technique with a woman who was struggling with severe test anxiety before taking the law school admissions test. We had her first do somatic quieting, imagine the scenario, and then walk through the different coping strategies that she might use. The technique is fairly straightforward. First, flesh out exactly what you want or need to imagine. Next, eliminate distractions and get yourself into a place of somatic quieting. Close your eyes and step up to your fear. The more vividly you imagine it, the better. Keep practicing your somatic quieting and try using some coping statements. You can do this. You have the skills. The worst case scenario isn't a catastrophe. I've been through worse, and hey, I survived. Stay focused on the fantasy and play it through until the end. Repeat as needed. Next up, I'd like to talk about something Mary Rowe at MIT has called microaffirmations. But first, let's talk about their opposite, microaggressions, which you might have heard about. Now, the term microaggressions comes from the work of Daryl Sue, who describes them as death by 1,000 paper cuts. A microaggression are those tiny little insults, those tiny little instances where you're overlooked, demeaned, or denigrated. Each one is itself too small and probably too small to intervene about, but those things can add up over time. Microaffirmations would be just the opposite. With microaffirmations, we're using our position, our social power, to do the opposite. They're called micro because these too are small, and honestly, they cost us nothing, but the effect can be quite profound. If I see a student sitting in class looking anxious, I'll make a point to go over and say hi. If I'm listening to a lecturer who seems to be struggling a bit, I'll be sure to make eye contact. I'll nod, I'll give lots of smiles and encouragement. If someone takes a risk and speaks up in a meeting, I'll thank them for their courage and tell them that they made a difference. If a store clerk or an Uber driver seems a bit frazzled, I'll express empathy and tell them I know how hard they work. The effect on others is to give them a mood boost, and the effect on me is the same. These effects are further amplified if you're the supervisor, the teacher, or just have a higher level of privilege or authority. Try it out as an experiment. Try making 3 to 4 microaffirmations every day and see what happens. It might just become a habit that we can all get behind. Next up is savoring. Now, savoring is a selective attention manipulation where we recall and elaborate a positive event that might have occurred in our past. It could be a vacation, it could be a victory, it could be some sort of success or happy memory. Now, we recall negatives all the time, but positive memories, recalling them to mind requires a little more effort. Maybe you could list out all of the big events. Maybe you could list out the small events of a day that brought you joy or happiness. Next, let's turn to a complex and common problem that can be addressed with a combination of CBT tools, psychological stress. We've all had it, and we all know that it can manifest in vastly different ways for different people. Let's lay some groundwork, then use our tools. Stress has been called a modern-day epidemic, whether it's from finances, politics, chronic illness, pollution, crime, or whatever. Surveys show that we're more stressed now than ever. However, stress is not equally distributed. For example, if you're a woman, you're twice as likely to suffer from severe stress and anxiety. This doesn't arise from having a weaker constitution, but most likely comes from life demands and disempowerment that men simply don't experience. For example, women do nearly 3 times as much unpaid domestic work as men. Women, even women with full-time jobs, still do the large majority of childcare. Think about the exposures to trauma and sexual harassment. Think about the eye-opening #MeToo movement. No wonder we see such high rates of gut-churning stress. The other population that has more than their fair share of stress are those in the lower middle and lower range of family incomes. They have less power, fewer resources, and are often just on the edge of going under. But what can we do about stress regardless of gender or income level? This would be a terrific time for you to break out your CBT toolbox and pick what you think might help. Be sure to look in both the behavioral and the cognitive categories. What did you choose? Behaviorally, I hope you pick some quick and direct tools to provide relief. Now, these don't fix the problem that caused you to be stressed in the first place, but they do put you in a better place so you can do that work later. Strategies would include things like getting regular exercise, cutting down on junk food, and drinking less alcohol. You'll also want to add in some somatic quieting just to turn down the level of arousal. Once you've accomplished that, what's next? Well, you might try some activity scheduling, especially social activities, and you might try graded task assignment, where you can break this overwhelming task into smaller pieces. Remember that your coping will fall into 2 main categories: emotion-focused coping and problem-focused coping. We probably need both, but do more with emotions if this is an unchangeable stressor. Do more to tackle the problem if the stressor is changeable. Okay, so that's our behavioral bucket. But what about our cognitive tools? What would you pick? Let's walk through a common cognitive exercise that draws on our thought record skills. Recall that when we face a stressor, we make at least 2 appraisals. Our primary appraisal assesses the stressor itself. Is it big? Does it matter? What are the implications? Our secondary appraisal appraises our ability to cope and the resources we have to cope with that stressor. First, you'll want to make sure you're making fair and balanced appraisals. To do this, you can use the appraisals worksheet found in our workbook, Minding the Body. Here are the main elements. Step 1, you want to name the stressor. So is this your illness, your finances, relationships, anything else that might be causing you stress? Step 2, you want to capture your appraisals, both the primary appraisal and the secondary appraisal. For the primary appraisal, you might ask yourself, how bad is this really? How important is it? What's the worst case scenario? What does this stressor mean? For the secondary appraisal, again, this is the one about your coping ability or your resources, you might ask yourself, what will coping require? Will it work? Can I handle it? Do I have enough resources? Do I have people on my team that might be able to help me out? When you're feeling really stressed or down, we tend to overestimate the severity of a stressor and underestimate our ability to cope. So be sure to keep that in mind. Now, the third step is to go back and reevaluate your appraisals. There's a lot of important questions that you can ask to help you get to a more accurate primary appraisal. How likely is this stressor to occur? Is it helpful to worry about this right now? Have I been wrong before? And have I worried too much before? What are the most likely outcomes if it does occur? And how long will this really last? Have I been accurate in the past? And what are the best and the worst case scenarios? If the worst case scenario happens, can I live with it? Can I learn more about the stressor and maybe prepare better? Important questions to ask to improve our secondary appraisals would include things such as, what resources are realistically needed to cope with this stressor? What are high-end and low-end estimates on how much of these resources will be required? What resources do I have at my easy disposal? What new resources could I maybe acquire? Have I coped with things like this in the past? Have I underestimated my ability to cope in the past? Who's on my team? Who's in my social support network? And can I reach out to people that maybe I've forgotten about? Step 4 is where you rewrite those appraisals. So you've done the analysis. You're now looking for a new primary appraisal, a new secondary appraisal. Write those down and then revisit your experience of stress. Has it diminished at all? Do you feel less stressed or more prepared? Keep in mind that you'll still need to do some emotion regulation and probably some problem solving, but at least you now have a more accurate and balanced appraisal of the stressor and of your coping skills and resources. Recall that the majority of the tools in our toolbox target emotion regulation and/or social, occupational, or physical functioning, two related but distinct areas. Interpersonally, we may struggle with irritability or hostility, defensiveness, shyness, or just feeling like we don't have the right to speak up, or a right to want what we want, or to feel what we feel. Learning how to be assertive, another complex and important skill set, might help us move forward. Let's take a close look at assertiveness and how our CBT tools might help. In the moment, unassertive behavior has certain rewards. You put aside your needs and take care of someone else. You get to be the hero. But if done over and over, it's a recipe for dissatisfaction, frustration, and resentment. Let's first address a common source of confusion, the difference between aggression and assertiveness. It's one thing to express yourself, but quite another to be a bully and to expect everyone else to fall in line. Here's an example. An aggressive coworker might talk over others, make demeaning facial expressions, call people names, or do things to intentionally undermine another. They often show hostility and emotion dysregulation. An assertive coworker might still disagree, but will let others speak, up to a point, because they need their turn too. They'll use phrases like, I see your point, but I disagree. Let's look at some of these other variables. Randy J. Patterson, a psychologist who wrote the Assertiveness workbook, says, if you take an aggressive posture, you're allowed on stage and your mission is to get everyone else off. By contrast, assertive people are collegial thespians who don't mind sharing the stage. They can be cordial even as they express an unpopular opinion. The classic book, Your Perfect Right by Alberti and Emmons has the goal of teaching people to express themselves while being respectful to others. They write, equality is fundamental to assertive living. Put simply, assertiveness is a skill. It includes being able to say no and the ability to express negative feedback, make your needs known, and how to stand up for yourself in a way that doesn't make others feel small. If you think of our CBT toolkit, you'll want to think about strategies that promote each of those skills. What beliefs or rules do you have about saying no? What do you think it means about you? Does your lack of assertiveness stem from a core belief? Are you using mind reading or fortune telling that discourages you from acting? This is a great opportunity to take out your journal and start clarifying the problem, the goals, and the tools that you will use. I'd like to end by sharing a few tips on how to say no and how to stand up for yourself by Catherine St. Louis, a health reporter for the New York Times. First, she suggests that we should be brief. Julie Hanks reminds us that no is a complete sentence. You don't have to go into an elaborate justification. Be gracious in declining an invitation. Express thanks for the offer and regrets in not being able to accept. Stall. I personally use something I call the 24-hour rule. If I'm offered an opportunity, I wait at least 24 hours before I say yes or no. I express gratitude and then I'll get back to them ASAP. Act it out. So you want to use your rehearsal skills. I had a patient who was a professional dancer and wanted to ask his boss for a promotion and a raise. He was terrified. But we rehearsed and we role-played, and he eventually got the promotion. So let's do a quick toolbox recap. What tools do we have now? Well, we've added in cognitive rehearsals, micro-affirmations, savoring, tools for stress management, and also tools to promote assertiveness and to help us say no. In our next lecture, we'll take a deeper dive into emotion regulation, when we need to do it, and what skills might work best. Thank you.